Hello, everyone. Happy New Year. I'm Qinan, a registered nurse and an actress from Los Angeles, California. And welcome to Transistors TV. Ali?
Hi everyone, welcome, happy new year. Welcome to Transgender TV. My name is AllyCat Castle. I'm a makeup artist and a co-host here with my three other amazing and beautiful, proud transgender Pinay co-hosts from different cities all over the world. And of course, very special episode tonight. And we're going to be talking about hair transplant surgery. Back to you, Angel, to introduce our other beautiful co-hosts.
Yes, and while we're waiting for our other sister, Ate Sonia from the Philippines, we also have Miss Faelnar from Los Angeles, California, with her eyeglasses.
Hi, all. Happy New Year to everyone that's watching. If there's anyone there, Happy New Year. And my name's Lee Faelnar. I'm here in Los Angeles, California, and I work in production. I'm also an actor. And on behalf of Miss J. Ally, Miss J says, Happy New Hair to you.
Happy
Thank
New
you
Year!
so much, Miss J.
So I'm
Okay.
just promoting it on Instagram and yeah.
So while you're
tell us
promoting it
a
on
little bit
Instagram,
about this episode on what's new about this format.
so basically what's new about this format is because, well, as you all know, I actually had my hair transplant surgery last December 23rd. And then since then, I've been posting my hair transplant journey for the past week on Transgender TV. I actually created a playlist for that because I really would like all of you to see how it goes from the day before, before the surgery, during the surgery, what you need to do during day 2 and day 3, and what you need to do as well from day 4 to 12, as well as my weekly recap of the hair transplant journey as well. But since I've been getting a lot of like DMs, that's the reason why we're here, is for us to talk about to answer basically your questions. And that's the reason why we're having this episode. And that's the reason why I'm not wearing any makeup. I'm also not wearing I fixed my hair in such a way just so we can really get to see how it's been done as well. So without further ado, shall we begin?
Yes, we shall. And if you guys are online, please type in on the live chat your questions and our greetings also. Happy New Year, everybody. Let me start by asking you about your hair transplant. Let's just start with the difficult questions. So what is the first main reason why you ever thought about doing hair transplant?
Well, the main reason why I actually did the hair transplant is because I actually got inspired from my friend who actually did it. And so I've seen how my friend did it from the moment that he just had it done until like the whole duration until it grew. And that's the reason why that actually gave me the idea to do it, because I finally have like a role model that I look up to push me to do it as well, because I've always been wanting to do it ever since. I just did not do it because you always hear good sides of doing the hair transplant, and you also hear bad sides of doing the hair transplant. So I was so scared. But this time, finally, since I knew someone personally, you know who you are if you're watching this, I want to thank you, because sometimes we just need a little push from that person who we trust in order for us to be a step closer to our dream. And I'm so happy that I finally did it.
Well, congratulations to both of you. I know me personally, I also thought about doing hair transplant for various reasons. I think being transgender person, like having a higher hairline, that's kind of like it comes with gender dysphoria, like thinking that it doesn't match who I am on the inside. Is that something that also came to your mind? That's why you even considered changing your hairline or anything about the hair?
Well, that's actually one of the reasons why I transitioned late. I actually transitioned at age 35 back in 2014. I even said to Angel, she's my real life sibling, that I did not want to transition because I have a high hairline and I have this how do you call that? Is it window speak or whatever? And I was so insecure about that. And Angel said, you know what, your hairline is not a definition of you being a woman. So that actually kind of like gave me an idea that you know what, that's true, my hairline doesn't define me as a woman, but definitely me doing the hair transplant gave me the confidence on facing my fears more than anything. For 7 years I've been looking in front of that mirror And I'm so insecure. That's the reason why I've always wanted to have that Vavavoom makeup. I've always worn that bandana. But deep inside me, I was really, really insecure and I was really, really unhappy. And the reason why I did it is because I want to improve my self-confidence as well.
Yeah. Do you look very serious there? I'm sure there's a lot of things that goes on in your mind right now.
Actually, I'm really excited doing this episode as well. I mean, like it's a scary decision, but I must say that it's actually like one of the best decisions that I've made. So if I can show you, to everyone who's been asking, I actually did an FUT, which is what we call a follicular unit transplantation. So if I could read to you the definition, FUT means is a hair restoration technique also known as the strip procedure, where a patient's hair is transplanted in naturally groups of 1 to 4 hairs called follicular units. So if I can show you, so this is where they strip the skin right there. I'm not sure if you see the suture line right now, but they cut it there all the way through the sides, almost like a horseshoe. I didn't realize it was like that much, but I was happy in a way because I felt like I had so much to be covered. And this is actually where they put the hair grafts, and on this side and on this side. And then the other one is what they call the FUE, which is what they call the follicular unit extraction, that uses small punctures to transplant follicles from all over your head to areas where your hair is thinning. So the FUE is more of like the individual strands versus the FUT, which is the stripe that they cut from the back of your head. And then after that, they have to sew your head as well.
Who usually does the FUT and the FUE?
From what I know,
Sure.
like,
I'll answer your question and then we're gonna go to Lee's question. So actually, Angel, do you wanna say something? Because I actually have some sirens going on right here.
Sure,
I'll
I think we wanted to
answer,
answer a little bit of the question, yeah.
Yeah, I'll answer the question because like I've always also been researching this a lot. Like because I've seen other people who still have like healthy hair and still do the surgery as well. So I'm also like, so for people that only have like small spots of like thinning hair, FUE is more recommended because like they just basically they'll shave like a part of your head and then there's a machine that's going to see like what follicles are like healthy for them to extract. Then they put that in sometimes I feel like they put that in your platelets. So like sometimes they'll also like extract some of your blood so that like the hair follicle will survive like with your own like platelets. And then that's when they're starting that's where they're going to graft the hair on the thinning areas of your hair. However, if you have a huge amount of hair loss, then and you have also a great amount of hair on like probably your temples or whatnot, then they're most likely going to use the strip method because that's when they're going to take a larger, healthier part of hair follicles and individually kind of cut it in small strips before like they do the transplant surgery. I'm not sure probably what takes longer because I know grafting would also take longer. But I believe a lot of people would rather like have FUE done because there's no like what Ally has like a
less drastic. So it's less drastic than what Ally's doing. And it sounds very intelligent because Lee is wearing eyeglasses and while she's explaining this. So Ally, what made you choose?
So basically, wait, let me continue with what Lee said. I'm sorry?
So what made you choose the FUT versus the FUE?
Well, the reason why I actually chose the FUT is actually, Lee actually explained it really well, is because if you actually have like a bigger chunk of an area of your head or scalp or anywhere that you need to be filled in, I chose FUT because based on my research, and of course everyone's entitled to do their own research, FUT has a higher percentage of a survival rate once it's implanted on your hair. FUE is good on certain areas, but the reason why I chose FUT is because they cut this like big chunk of your skin, right? And once they cut those into pieces, into like those little hair grafts that they're going to implant, each of the hair grafts can be at least 1 to 4 versus FUE, which is usually just a single unit. And the problem sometimes with FUE, like you really have to go to like a very good doctor for that, if ever that's your concern. they don't have as much of a fat cell that will support the hair. So that's the reason why I believe the survival rate is lower as to compare to FUT. So again, if you have a bigger chunk that you need to be filled in, like me, like I have this big chunk right here and thinning right here, that's the reason why I chose FUT. But they actually said that in the future, if in case you're happy with how everything grows, and let's say I would like to have a retouch or something, I may consider FUE.
Wow, very technical. See, you guys are learning so much today, both from Lee and Ali. But before that, we just saw that Miss Sonia joined in, and we're gonna say hi to her in a little bit. You joined in like in the middle of a hot conversation here, and everybody has been also joining since we were talking. Let me say hi to everybody who's here. Hi, Dax Bayani. Hello, Happy New Year to you also. And Nikki Despi said, "Hello, madams. Happy New Year. I'm so happy that you made a right decision to make yourself happy and proud." See, Ali, people are very proud of you. I'm proud of you for doing this. Kuya Ram is saying also Happy New Year. And then Bob Holmes is saying, Ali, I hope this winter will be an easy one while you're recovering. And Nikki is saying, Ali, you define yourself. You don't let others define you. I'm proud of you and we support you all the way. See you soon. And thank you, Nikki, for taking care of her, like bringing her. Yeah, Ali wanted to say something, and then let's have Ate Sonia introduce herself, and maybe she has a specific question right away that she wants to ask.
Sure, and that's the reason why it's also very important to have like a support group, because this is such like a very emotional experience. Nikki is actually a very good friend of ours. So my appointment then was at 8:00 a.m. She wanted to make sure that we're going to be on time. So she picked me up at 6:30 a.m. And then after that, before the surgery, you need to have a full stomach. So we went to Wendy's first. We actually had a Baconator breakfast meal before we went there. Make sure that also before your appointment or your surgery, that you don't take any alcohol or caffeine as well. And make sure that you actually have a full meal. So there.
Sounds good. So we're going to be talking a little bit more about the surgery in a little bit. Right now, we're talking about like almost everything pre-surgery. And then we're going to be talking about the surgery and how you feel about the surgery, maybe the cost of the surgery and everything. And then maybe we're going to like see and talk about what to expect later on. But Ate Sonia also joined in all the way from the Philippines, our fashion stylist friend from the Philippines, Miss Sonia, the only one. Please introduce yourself. And if you have a question, a pressing question right now, go ahead and shoot it after introducing yourself.
Mabuhay ladies, manigong bagong taon, Happy New Year to everybody. Omedeto akameshite, omedeto gozaimasu in Japanese, and in Tagalog, manigong bagong taon. And of course, welcome to the Philippines. And technical difficulties are for the new year. So I'm proud of you ladies, and Ali, I'm proud of what you are doing now. And of course, this is a moment in your life. So, omedeto, congratulations in Japanese. And I'm a fashion stylist, and I'm part of a production team here in Manila, the Philippines. Mabuhay!
Mabuhay.
Okay, so let's go back to the questions. Welcome back, Ate Sonia.
Do you have any pressing question or feedback about hair transplant surgery?
Oh, of course, in a chunk of beautiful women I've been with, that's also been their issue, their hair problem. So I think I had a lot of ladies also that done that FUT and the FUE in their part of their head. So basically, as we are in the before the surgery, that's very good. You have to be with a friend. You have to be very well. You have to have a full stomach, and you're mentally ready for that. And it is a decision that will really put your self-esteem up, because our hair is our crowning glory. So it's better that you did it now before later. So I think the best question I can ask for you, Ali, is, were there times that you should have done it before?
The reason why I did not do it before is because, again, I did not have like a perfect role model, because I always wanted someone to have done it first, someone that I know, because it's always hard. Like, for example, even transitioning as a transgender woman, I think that if Angel did not transition first as someone that I'm blood related with, then I would not maybe have the guts to do it. because it's so hard for me to just navigate things on my own. So I feel like I need someone that I trust, like that I've seen who has done it before I can actually do it myself. Because on that sense, I'm not a leader, I'm more of a follower. And that's the reason why I'm putting my story out there, is perhaps to be, it's easier sometimes to do things and to ask things or questions when you personally know the person. So to all my friends out there, to all of you watching this, that's basically like why I'm putting out this story. It's basically to normalize surgeries, because a lot of people always put a stigma on it. That's the reason why a lot of people hide their surgeries. It's something that we need to be proud of, because you know what? If it's going to be for your self-confidence, then you should do it.
I want to follow up on that question. So how far apart was the surgery of that person that you made into like your, what you call this, like your, your mentor?
Well,
How far
I've seen
apart,
the
and
person's.
then after that, like why, like after seeing their progress and whatnot, why did you choose this time of the year to have it done?
Well, because I've seen the person's progress. I believe the person did it, if I'm not mistaken, earlier last year of 2021. And then I've seen definitely the results sometime around like summer and then gearing through. And then I kept on waiting sometime around September, October. I was like, putting it on the side because, it's a lot, and I feel like once I'm the type of person that once I do my research out there, I know that I'm not going to stop. And finally, I did my consultation last November. And thank goodness that when I actually talked to several clinics. And the reason why I chose this one is because I actually went to someone who I felt comfortable with. You want to make sure that you really go out there, because some clinics you don't even get to talk to the doctor. You want to make sure that you also get to the doctor who's going to do your surgery. Some clinics, you can only talk until the sales agent. And if the sales agent feels like as if you're not going to do a deposit or anything, then you'll not be able to have a consultation with the doctor. And for me, that's a little bit of a red flag.
Wow, that's scary. Ate Sonia brought up a big, I think, very important thing earlier that I want to ask. She said that you have to be mentally prepared. What things did you do, Ali, to be mentally prepared for this surgery?
I just knew it's time. And for all of you who want to do it, you will just know when it's time. And when you know it's time, there's no mental preparation anymore, because the process is you doing it practically. You get what I mean? Because the more you're going to think about it, the more stress you're going to go through. You just have to like really get the phone, start doing your research, call several clinics, talk to several people. From there, you will know it if it's your time or if it's not your time. And if you're not happy with the clinics that you've called, the people that you've talked to, then just keep on searching more until you find that person who you think is the best person to do the job for you.
Lee, I think unmuted. Go ahead.
Yeah, so I also want to like bounce that question to all of y'all, because I know like it's not only Ali who has done surgeries in this group. So like, is it the same? Like, is this what Ali say resonate to the other people on the panel?
Definitely for me, like I did the top surgery, and before the top surgery, I did my research. I did a research on the different doctors. I actually consulted with 3 doctors also before choosing the doctor that I chose with. I chose a doctor that has more experience with transgender people here in Los Angeles. I met up with a few of our trans sisters who have done the top surgery, and I made sure kind of like to ask the good question, like any questions that come up in my head. Like sometimes new questions come up when you're a new person, and it's okay. You don't have to have the exact number of questions, because sometimes the questions will just come up. So similar to Ali, I think I did prepare myself before doing that surgery in terms of reaching out to the community and asking questions, going on the internet, researching the doctors and seeing the doctors and doing the consults. What about you two?
Sonia, go ahead.
Yes, you're so on point, Ali. And I think you just a very, very important thing. Research, have a role model, have someone that you will think that have a great doctor, not just any doctor. There's 101 and only one will make you comfortable and confident that this is my doctor. As far as I would like to tell you that I'm I'm a surgery. I'm a gazillion of surgery here. So, I had already had that process of researching and seeing my role models and ask a lot of questions and shopping for the best doctors. You just cannot just you don't as I can tell, you don't think about the the price of cheap, because don't go to those fly by night doctors, those cheap doctors. My God, you're already putting your life in danger. So make it, just spend a lot, spend money on what you're going to what surgery you're going through, because it is a lifetime commitment and it is a maintenance forever. So you better choose who's the best, spend money on it, because it is your body. As I've said, love your body, do what makes your body makes you feel right. And for me, it was not a overnight process of being this, because it took me to 20 years, also 10 years before I really made that decision, especially the whole vagina surgery here. So it took me, I was already 30 years old when I did that. So it was really a process. I think 30 was the start of my surgery. And I said to myself, 30 years old, I will start my process. So, I started with my nose, with my boobies, with my this, with my that, and my that. So it was a 10-year process. And I think the grand finale was the vajayjay. So, it
At
was not like
40. Oh my God, I'm turning 40 this month.
so, and I said to myself, and I've witnessed everything, that surgery has no age. When you feel like it, do it, because it's for yourself. So just do it and be beautiful. And of course, no pain, no gain. So as I said, my friends always says, no, beauty is pain.
Well, we have a few other episodes about surgeries, and we kind of spoke about all our inputs and views about that. Tonight is specific to Ally's hair transplant surgery. But Lee, did you want to have a quick answer also on that question that you want to share with your experience with surgeries?
Well, I never went to like a doctor for any type of procedure, but I've consulted for reconstructive procedure for something that I've done illegally. And I've never went through it because I thought to myself, I'm like, you know what, I already did it. If something happens, then it happens. But that's why. But I did go to like a ton of people, and I did like want to do it. But that in the end, I also decided, like, you know what, not it's not the time yet. Like if something, because like regardless of how good the doctor can be, there's still like a risk involved. And at that time, I wasn't like ready to get myself, like I wasn't mentally ready to like put myself at risk again after going through something that like put me in a spiral of depression and anxiety. So I think that's why like mental preparedness is like a huge factor when it comes to surgery, because you also have to prepare yourself for when something doesn't go the way that you're expecting it to go.
Thank you for sharing that. And before we move on to the surgery, because there's so much things to cover tonight. I want to say hi again to our viewers online. Ali, Callie, Adesi, Happy New Year, sisters. From Lena says Happy New Year, and she said don't forget to thumbs up. So if you are enjoying tonight's episode, you can put an X on this one and then do a thumbs up. And then go back to our live chat. And if you have any questions, please type in your questions on our live chat tonight for Ali for hair transplant. She's going to answer any of your questions tonight. And then Ali Callie did a thumbs up after Lena said, and right, and everything Lena said, everything just falls into place. So so it sounds like Ali, before you did your surgery, you did all of your research already. If you're going to do FUT, FUE, which doctor you're going to go to. Let's talk about the cost.
Sure. I paid $15,000 for my surgery. Let's go straight to the point. $15,000. I had to deposit $500, and then the $14,500 I need to pay a week before my actual surgery. Again, this is different with every person who's gonna do it. But that was like the price that I needed to pay in order to do the surgery that I need, because more that needed to be done. It's not just like you're just filling in certain like areas. I would really had like a big bald spot right here, like two big mountains right here, and a little bit thinning right here as well. And that's the reason why that's the reason why they did it there.
So what range of prices were you seeing out there when you started your research with the other doctors and types of surgeries?
Well, like the other clinic that I went to was like $1,000 less than the one that I went to right now. So it really depends on the grafts. It really depends on how big the area is. It really depends on how much hair they need to put in your head. You know, I mean, like if I cannot really say it personally, it's a case to case basis.
Right.
But yeah. So
and have you considered doing it outside of the country for cheaper? Like maybe, I've heard a lot, like let's say Korea and Philippines. Is that something as part of your research that you've done?
I didn't want to do it because I felt like I live in the United States. If something happens, I want someone liable for it as well. More than anything, I know that a lot of us sometimes we would like to save money, but your safety comes in first. Just like what Ate Sonia said, you want to go to the person also, not just who you trust, but who you think has a very good track record. And just like what you said, Angel, I mean, I also went to this doctor that I went to because my doctor actually has done a lot of like transgender patients as well, where I've seen their work and also had a testimonial of their work done by the doctor who did my surgery as well. So for me at this point, I did not consider overseas operation. I want to do it here because I live in the United States.
And have you considered insurance? And Lee might have an input with this later on, but have you ever considered insurance or asked insurance if it's something that's going to be covered? Do you think it has to be covered? And maybe Ate Sonia can also share her experience in terms of cost with the insurance, with the surgeries.
Well, hair transplant surgery is not considered as a typical essential surgery. It's more of kind of like a cosmetic procedure. And that's the reason why I did not even consider looking into the insurance, because if I do that, I'm going to run out of time. And I need to do it now because as busy as I am with my job, if I miss this, I'm actually the last appointment for the year 2021. If I miss that appointment, there was like 2 slots available. I cannot wait until like August next year to have like a surgery done, because I don't know also what could happen at that time. So that's the reason why I did it.
Lee, did you have any input about if it's going to be covered by insurance? Do you know people who have done hair transplant that's covered by insurance? Maybe here in LA, I know Kaiser is doing a lot of transgender surgeries, but I'm not exactly sure how hair transplant is covered.
Neither do I. I don't even think like what Ali said. I think like it's more considered as a cosmetic surgery. That's why it isn't covered, which is a shame because like a lot of people don't have like finances, especially in the trans community. Not a lot of people would have the same type of like privileges that most like us here in the panel to like us here in the panel to like do those researches. So I kind of think it's unfortunate that, I mean, maybe hopefully for some it can be covered, especially if it's deemed necessary for the mental health, because I think mental health is also a medical concern.
And that's very interesting to me because facial feminization, wherein they would pull your hairline down, is covered now sometimes at some insurances here in California. And of course, laser hair removal also is sometimes covered already. So before it was considered cosmetic, but now it's being covered because it's part of the transgender health. And I think that's part of gender dysphoria, as what we spoke about earlier. And I think it should be covered in the future. But unfortunately, it sounds like it's not yet covered at this time. Yeah, Ali, you were going to say something?
I definitely agree with what you said, Angel. Hopefully, eventually, it's something that will be covered by the insurance. I mean, if they can actually do the lowering of the hairline, if they can actually do like facial feminization surgery covered by insurance, as well as I'm sure this is the old term, the sexual reassignment surgery. I'm sure in the future, hopefully, that they can also do the hair transplant surgery as well.
Okay, so let's go to the surgery questions. What's the most painful part of the surgery?
The injections. I mean, the injection. I didn't realize that the injections were more than what I expected. They actually did, okay, in total, they did 45 injections on me. They did 15 injections in the back, and then they also had to do 15 injections right in the front.
And you're talking about anesthesia before even starting doing the actual surgery.
I believe that's the anesthesia, were the injections. And I only took one Valium. I mean, usually you have a choice if you want to take more than that, but I want to be awake because I would like to be able to share my experience. But oh my God, after like the third injection, it was really hard. You know, like someone had to hold my forehead right here, like the other technician, because it was really painful. But I was already there and I felt like I needed to do it, you know. So more than anything, I mean, I had like a mental pain for like 7 years facing the mirror. So I felt like, you know what, if this physical pain is painful, but the long-term benefit of it is more beneficial, then I'm gonna do it. So it's painful, but it's worth the pain. And as what I think as Sonia said, no pain, no gain. It hurts to be beautiful.
I'm sorry.
It's okay.
Yeah,
It doesn't know why we talk about this. You know, I mean, like, because when they asked me, I was like, and they said, why are you crying? I said, it's painful, but it's a combination of the physical pain, but tears of joy that I'm so happy that I'm finally there doing it. Because if there's one surgery that I've always wanted to do, it's the hair transplant surgery. You know that I'm not gonna get a boob job. I'm not like a boob kind of person. Don't get me wrong, I have nothing against all these other surgeries, but that was like the one thing since I transitioned in 2014 that I've always wanted to do. And I never knew that it would come to this moment. And I'm so happy that it finally did it.
I know. Yeah, I know it's an emotional discussion for you, but like just so that also the people can know, and also if the people have any, like the people in the chat room have questions, please like ask them as well. We'll try to read them out so that Ally can answer it. Can you describe the pain? What kind of pain is it? Is it a sharp pain? Is it like somebody like punched you in the head? Can you describe it a little bit further for like the people in the chat room and for us?
Well, you know, sometimes when you go to the doctor, you know, when we get our checkups and things like that, they get blood right on your vein. That's nothing. It was really painful. The most painful was in the back. And then had to do like the front. Because they needed to do that because they need to cut the skin right in the back. And then after that, they need to like sew your skin that they opened. And then after that, they put this bandage and bandana. And then you take a break. And then when I come back, they had to do 15 more injections right in the front because after those 15 injections, they need to do the holes right on your head where they're going to plant the grafts. I'm not crying because I want to scare everyone. It's like what they said, you know, that's when you're like, I guess, like what Lee said and everything, like you need to be mentally prepared, but it's, again, you know, sometimes we need to face our fears, you know, like, do you want to regret in your life? Or do you want to be in pain for the next 10 minutes for your long-term happiness? That's the question right there.
Well, congratulations for surviving that 45 injections plus the cutting and implanting, and you're still working on it right now. Yes.
But after those injections, you're not gonna feel a thing anymore. Everything will be a breeze. The only painful thing is your butt sitting there for several hours. So after the injections, everything is a breeze. They feed you, they take care of you. They make sure there's like a big television there. Do you want to watch TV? Do you want to listen to music? Do you want to be on your phone? That may have been the most painful injection of my life, but the best most painful, but the best injections as well, I think. So we'll see how everything progresses in the next 12 months.
Wow, so anesthesia works. So if you're getting those anesthesia, just think about that it's, you know, a start of a great day, it sounds like. So from what you're saying, you're awake for the surgery. And you said you chose to be awake. So is that an option to be put to sleep or be awake? And why did you choose being awake for the surgery?
Well, because everyone that I've heard who has done it said they were awake. So I said, why am I going to sleep? Plus, I felt like I wanted to document this as well. You get what I mean? Because I really haven't found someone who really like put it out there that I know personally, who was vocal about their hair transplant surgery. And I know that the reason why I waited for 7 years is because I've been waiting for that person that I know who I can ask personally if they've done it, and I never had one. And that's the reason why I'm very, very thankful for this person that I know, because if he did not do it, I will not do it. You know, that's the reason why relationships are important, you know, because you have a direct access to ask that person what needs to be done. You get what I mean? Because more than anything, you don't want to hear it from people you don't know. You want to hear it from someone you know. Yeah.
That person is God meant for you. How long was the surgery?
So we started at 8 o'clock a.m. and then you had to do some paperwork. And then at 8:20 is when we started the drawing of the hairline. By the way, that's very, very important. Make sure that before the surgery date itself, if you're going to have a hair transplant surgery, that you actually have a previous consultation with your doctor about the kind of hairline that you want. Because I remember my initial, the first consultation I had with my doctor was on the phone. After that, I met him in person. And then in person, we first drew the hairline that I wanted. And of course, me saying, not knowing better, I really, really want a low hairline. Because, you know, women have low hairlines. And so he kind of said, like, you know, the benefits of if you put it low and if you put it high. But you also have to remember how much donor hair in the back of donor area that you have. Because as you age, don't get me wrong, all of our hair will eventually thin out, will not be as, you get what I mean? So that's something that you need to take into consideration. So I remember on the day of my surgery, I said, you know what? I kind of like my high hairline anyway, but my main concern really was I needed this size to be filled in. So you need to really do your research about the kind of hairline that you want. Have realistic expectations, okay? Because again, it depends on the kind of like donor that you have, like from the back, and also work with your doctor as well, because both of you need to be happy. It's teamwork. And then from there, you trust everything to them.
Lee, you unmuted.
So wait, so basically, when did you decide that the hairline? Was it like during surgery or like on one of the consults?
One of the consults. So on my second consultation with him physically is when we first kind of like drew our first initial kind of like hairline. Because I said, I want to see where you're gonna do it or things like that. And that's the reason why it's important for you to choose a clinic where you can actually meet the doctor and can explain things to you. You get what I mean? To some other doctors or some clinics, they're just gonna say yes to what you want. Meanwhile, is that really like what's best for you? Because after that second consultation where we did the hairline, I had at least like 2 or 3 weeks before my date of surgery that I kept on thinking and thinking about what's best for me. And I was looking at like a lot of pictures, like have that visual representation that can say, is this something that's also doable for me? So I looked for pictures where it's kind of like similar to how I looked. And I said, is this kind of like something that's doable? You know, like I'm not expecting that my hair will be the same as when I was like 13 years old, but I just want to have like a decent hairline.
So did you bring Tyra Banks' picture then?
No, I brought, believe it or not, I showed a picture of the current Miss Philippines Universe, Beatrice Luigi Gomez, because she has like a little bit of a high forehead, but with a little bit of baby hair on the side. So I wanted someone who, I'm Asian, so I feel like I needed to have someone who's kind of like in that same look as well. You get what I mean? So just for your own peace of mind as well, that you did your homework, and I'm not gonna say that I'm gonna look like her, but just kind of like in that feel, and the person can also have an idea of what you're expecting.
Let me say hi to our viewers. Oh, Ate Sonia has a go ahead, Ate Sonia.
Yes, that's true. You have to have pegs. Pegs. You have to have inspiration, because where are you going? Where are you taking this? You know, and you have to show the doctor that I want to be like this. I want to have this. So can this be possible? Can we deal on this? On what will happen if I choose this and that? And of course, you know, Ali, Bea just had a haircut, and you're in the same length of hair.
Also,
So
she basically saw our. No, I'm kidding.
yes, yes. So you're in the same track as with Bea. So, that's true. It is a process. The process is, it's grueling, but the surgery is really. I can feel the surgery. It's really painful, but as I've said, after the pain, it will be a breath of fresh air. So, you're on track, Ali. You're on track, and congratulations.
Thank you.
Yeah, hear it from our ate. See, Ali. So let me go back to our viewers. So Ali Callie Adesi said, "Oh my gosh, Ali, thank you for being so honest. I'm so happy you got this surgery for you." Lena said, "The pain plus with accomplishing your goal, it's bittersweet, definitely more sweet." And then Nathaniel Tech, Ali, you're so brave. Love you. Sel and Nathan. And Veronica Ray says, "Go, Ali. So inspiring. I want JLo's hairline so I could do snatch ponytails and buns." Did you think about JLo or other big celebrities here in the United States that are non-Filipino?
No, because I'm just, me. Um, I'm a proud Filipino. I'll always be a proud Filipino, and I love our beauty queens. And Veronica, I know, I see your hair. You have very healthy hair. You have a very good donor area. Do it. You're gonna be so happy. You're already beautiful, even if you don't do it. But you know what? If you've been like questioning about it, it's great. And by the way, you think that um after the surgery, by the way, it's also very important for us to talk about the aftercare, because there's more work that needs to be done after the surgery as well. Like, for example, once you get home, like after the surgery, you cannot carry heavy stuff. I was blessed enough that I have a friend with Nikki as well, Miss Catherine, she picked me up because I actually brought chocolates for the crew. I gave chocolates to everyone. And then my doctor said, "Your bag is so heavy. You cannot carry this. Someone's going to pick me up." I said, "Yes, she needs to carry your bag. You cannot carry heavy stuff." So I'm very thankful for my friend Catherine. She had to carry that. And then and when I came home at night, you need to sleep at least in the next 3 or 4 nights at a 45-degree angle. They gave me that kind of like this horseshoe pillow, because you cannot like really like almost like move your head or like touch the grafts, because you can lose that. You get what I mean? So there's like a lot of aftercare as well.
Lee, you're about to.
What's the science between from not being able to carry heavy things? Is it because you were anesthetized for so long, or is it because you have a suture line that they just close and that might open up?
Correct. Lee, see, I don't even need to answer this question. That's because you have a suture line that was basically like a fresh wound that was basically like sewn, right? Like, I'll be honest with you, 3 days after, that dried blood is like the grossest thing ever. It's so gross though that I was like picking on it and it felt like those little crusts, because it was really that much blood. I mean, that's the reason why. And head is like a very important like surgery. Anything where they're gonna cut your skin, really, really, really think twice. Make sure that you really go to a good doctor, just like what Ate Sonia said. I mean, sometimes it may be expensive, but it's your life. It's you never know. You really want to go to someone legit. It's hard if you don't go to someone who's not legit.
So Veronica Ray mentioned about the hairline, and I watched your videos. Thank you for sharing those. And I've seen like kind of how they drew, and then it's a little bit of zigzag here in the middle and then kind of straight again. And if you want to even show them, so it's a little bit of zigzag in the middle. Is that your choice, their choice? How did that come about? And tell us a little bit about it.
This is when we can actually thank the history of hair transplant. That's the reason why a lot of people get scared doing hair transplant, is because, you can see it, that they had a hair transplant 10 blocks away from you. Of course, through the years, like so many things have evolved in terms of technology, the zigzag will give it more of a natural feel when everything grows already. So, you just really need to trust like the process. And again, like with my doctor, he has like several YouTube videos, both of his patients giving a testimonial on the day of the surgery, and even like after a year of surgery. He has done a lot of like transgender patients. So this is my thing. It's like, go to a doctor who has done a lot of people of your kind. You get what I mean? Like me, I'm a transgender woman. So I felt like I needed to go to someone who has done a lot of like transgender patients. Because for me, that's important. That person will understand not just my physical needs, but more so my emotional needs as well. You know, because the more that we go to, people who are experts at what they do, the more we can also help our community. So
yeah, and I think it's very important that you have trust with a doctor, especially, oh my God, you have 14 injections done to you. And if you don't trust the hands of the people who are working on you, then it will be extra scary. Like, I was under general anesthesia when I did the top surgery. So it means I'm under his mercy of the doctor at that time. So if I don't trust them, if they're a hater, I mean, who knows what could happen. And I think that's why it's important to pick somebody who you trust and who is an ally also to the community.
Yes, that's true. That's true. You have to have the best doctor that you're comfortable with. And if something goes wrong, what will happen? And that's right. You have to be with a family member, a dear friend to you during your surgery, so you have a witness, and they know who's doing your surgery, because yeah, he's the best doctor, but if something goes wrong, at least you have someone with you that's a witness. So that's very important. And regarding that surgery, doing it overseas or doing it in another country, it's just another cost. It just add costing. Why not just put it in your surgery, so you'll be, as Ali said, the doctor is nearby. If something happens, then you can just go directly. Something's going wrong. What's this? Not like if you do it here in the Philippines, then you go back to the States, and if something goes wrong, what, it will be virtual. Are we gonna message me? What will I do? So it will. My God, you're in pain already. You're mentally, emotionally, and then you have trouble doing what is something going wrong. So that's good, Ali. You're doing it. You done it. The doctor is just there, and that's just right. And it's the care that's very important after the surgery.
And I also have like the phone number of my doctor as well. He's so kind enough that in case I have any questions, he would answer it right away. Like for example, I'm just gonna say it right now while I'm here. Like for example, on day 4 to day 12, that's the time that you need to shampoo your hair. So I'm just gonna say it. I actually use this particular brand of shampoo. I'm just gonna say it now, but there's gonna be an episode coming out. I use Johnson & Johnson's baby shampoo. Unfortunately, on the day 3 of me doing it, so basically started using it Monday. On Tuesday, I saw some red spots, and then Wednesday, I had to stop that. So you get what I mean? Like, thank goodness I actually have another mild shampoo that I bought, just in case that doesn't work. I have something else, and then they also have like an aftercare phone number that you can call as well anytime, and they've been very helpful. So the communication with your doctor as well as with the people involved in the clinic is just as important after your surgery.
And we have a question from one of our viewers, Veronica Ray. How much time should I take off work to do this kind of procedure?
Okay, you need to at least be off for 2 weeks. It's because it's within those 2 weeks that you need to do like the most. Here, I'm gonna give you the duration.
Yeah.
Day 1 of the procedure is considered day 1. Day 2 and day 3 is the first 3 days is the most crucial point of you not touching your hair grafts and making sure that you sleep at a certain angle. And then day 4 to 12 is when you have to
have somebody with you on that first 3 days.
No, only on the first day at least, and then the rest. So basically, a solid 2 weeks. So yeah, because after that, before the second week ends, you need to go back. If you do an FUT, for them to take off the stitches in your head. So a solid 2 weeks is very essential. But usually, like after, I would say 7 days, you're most likely assured of whatever it is that you did not touch in your head, that's already solid on your hair. Yeah. But if I were you, Veronica, 2 weeks. That's actually what I did to myself, like 2 weeks. And then you can start wearing a hat, I believe. It depends. Like some of them say on the 4th day, some of them say the 7th day. But for me, I just don't want to wear anything of those. I mean, I need to go back on the 12th day, but at least I have like 10 days that I know that I was just at home. I did not do anything. So at least 2 weeks.
Yes, that's true. 2 weeks is that's the best thing because you're sure. You're so sure. Oh, okay, I'm good to go because when I did mine, I'm just telling this, in Thailand. I did my SRS in surge in Thailand. I was there for 3 weeks. 3 weeks. 3 weeks because I have to be sure before I leave Thailand that if something goes wrong, I'm still there. If something, you just have to be very sure, and the doctor is there. So it was a very very long grueling 3 weeks, but it's just worth it because you just have to be very very sure, and that's good, Ali. That's very good of you. You have to very very sure. So
yeah, because just like what Ate Sonia said, you pay this much money anyway. Just take off, because again, your body needs to heal from the major surgery as well. Like hair transplant is not, it's a major surgery. It's just as painful as other surgeries.
And I think Ate Sonia brought up an important option also. So if you're planning to do a cheaper surgery outside, then you can plan for a specific time frame to be there. So just in case something comes up and happens. Ali, you mentioned earlier today. So it sounds good that you trust your doctor, and it sounds like that you can watch TV and like eat with them and talk with them. What's the best thing, or what did you like most about the surgery day?
They were very organized. They pretty much have everything like in a timeline. I think we extended more than our supposed time, but for me, that's a benefit to me because perhaps they were really wanting to make sure that because there was a lot to be put on my head, and that they really just took care of me and how organized they are as well. That's what I like.
How long did it take for the whole thing from coming in to leaving?
7 hours.
7 hours.
Mm-hmm.
Okay. Any other questions about the surgery before we move on to what to expect, what's going on now, and other things?
Oh, the surgery. Well, were there was during the surgery, did they really what was the most important thing that the doctor told you before doing the
before the actual surgery?
Yeah,
again, you need to have like a full stomach like before the day of the surgery. No caffeine, no alcohol. By the way, to those people who are thinking that they're not yet doing the surgery, finasteride is very important. Especially if you're like male or male to female or transgender women. I just want to like be blunt like that because especially with when it comes to like male pattern baldness or things like that, women natural born women, how you said, I don't know, I'm just gonna like, I'm sure I'm making sense right now, I just want to go direct to the point, are more blessed with hair than like if you're not genetically born with a vagina, there you go, then it's harder. So exactly. So if you're male to female, or if you are male, consider finasteride because finasteride can actually preserve the existing hair that you have and can strengthen it as well.
So here in the United States, that's prescribed. So consult with your doctor if you qualify for finasteride. Cisgender females, I think, does not qualify for finasteride. That's, I think, what Al is trying to say. So are you happy with the results right now?
I think I'm happy with the results.
And like, the placement and what's going on.
I think I'm happy with the placement right now. I'm actually, more than anything, I think I'm just happy that I followed. I'm just happy that I did not scratch a certain graft. I was just so scared for the first 3 or 4 nights because you really need to sleep at a certain angle. And because I usually sleep right with my head on the pillow. And that's why it was like so it was really hard for me. But by the way, if you don't have like a lazy boy chair or like a reclining chair, I just put like pillows right behind my bed, and then I put like the neck pillow, and then that's actually just how I like slept for like at a 45-degree angle. It's hard in the first night or second night, but then again, but it's worth it in the end. But just so you know, I believe on the third or fourth week, eventually all these will fall off. On the second and third month, when it may look the worst, it would look like as if it was like back to I did not do anything. You know, all the scabs are going to be gone. If I'm lucky, I will see early budding sprouts come April or May on the fourth or fifth month. So again, it's different with every person, but you really need to give it time for a year, because some people are not even lucky enough until the ninth month for them to see the sprouts, and then just keep on growing. You get what I mean? So it's really a year of waiting, and that's the reason like I would like to do like a monthly follow up to really be honest if anything grew or anything like that.
So what we're seeing right now that you showed us on screen, all of those will fall off.
Eventually, all of them will fall off except for the existing hair that I have.
Yeah.
So what happened was they need to shave this part as well, because I actually had hair here, and they had to shave that part as well in order for them to be able to put the holes on some of the areas of where my existing hair is to thicken it up even more. So we'll see how it goes. You just have to like trust the process.
Wouldn't you consider like the ones that are there right now, just like the holes healing up from like their procedure? That's why it like you would consider it more as like, you know, just like it trying to crust up so that it would close, because they did puncture it, right? Even though
Yeah.
it was small puncture wounds. That's why like probably it after it kind of heals and like regrows, and like your skin's gonna like renew, it's gonna look like nothing really.
I think the idea of like the crusting and the scabs, you really want that to happen, because I feel like it's almost like sealing in the hair in the follicle or in the whatever man-made hole they put in your head. And that's the reason why on the first 2 days, it's like you only rinse with water. You cannot even use, by the way, your shower head for 2 weeks. You need to would rinse it off with like lukewarm water, and then on the fourth day to the 12th day is when you basically massage your shampoo with mixed water right on the grafts, and you rinse that off, and everything is air dried. I cannot towel dry anything until after 2 weeks. Everything needs to be air dried. And only after 2 weeks that I can use the direct shower head. But I think I'm not gonna do that until after a month. I'm just like very paranoid.
Are you gonna use the Filipino tabo?
Correct. The Filipino tabo, or you know when you go do those takeouts and it's kind of like a big container. I just really clean that well. And by the way, what to expect? So after your surgery, you're gonna have your face is gonna be swollen. I believe like that night, and on the second day, third day, it's gonna peak to the fourth day. It's weird because I actually did this on my earlier videos in chunks. Like, I remember this forehead of mine, usually there's like a division. It's almost like just went straight to my nose. And then after the swelling on the fifth day, it's gonna go down. You're gonna see bruising. I still have a lot of like bruising. You cannot just see it here, but it's a bit greenish yellow. And then after the bruising, it's really a whole thing. You're gonna be ugly for quite a while. But you know what? The happiness inside you, you don't effing fucking care about how you look on the outside anymore, because you know, hopefully what you've invested on hopefully will prevail. So
we're about to go over time, so I'm gonna do like our last questions, and then so I don't know if you, Lee, or Ate Sonia, or anybody on our viewers, if you have any other questions, please type it in now so we could do quick answers for those questions before we go over time. My last questions for you, Ally, is why are you so open and like in sharing your story in terms of the hair transplant journey?
Because I believe, and I've seen this both in the transgender community, as well as with I mean, when it comes to like men as well, because you know what, I have a lot of like male classmates. I went to an all boys school before. There's always such a stigma when you actually do surgery. We need to normalize this. You're doing your surgeries for self-confidence. Let's face it, when you have self-confidence, you're going to be happy. And when you're happy, you can be more of like a better citizen for others. You can help others more. Every person's story can inspire someone. So the more stories is out there, then the more can perhaps people can relate to specific people. You get what I mean? And that's the reason why I want my story out.
Thank you. Veronica says, when you're taking a shower, you can use a shower cap, right?
You mean a shower
Like
after the 2 weeks or before the 2 weeks?
No, when you take a showers, can you use a shower cap so that the shower head, or like to shower your body?
Oh, to shower. I did not use a shower cap. I just don't want to put anything on my head for the first 2 weeks. Nothing on my head. I mean, at least on the 12th day, I can put something. I can wear a hat or like my bandana. But no, at home, like for the next 10 days, I'm so scared until like that really like all the scabbing is like gone and things like that. I think that's like the only time that I would really wear something on my head.
So when you shower like your body, do you not also use the shower head as well?
I don't use a shower head. Like what I said a while ago, for the first 2 weeks, you just need to use a tabo or like a little container and you gently pour it into your head. That goes for the first two. Oh, for the body, well, you can use the shower head, but I'm scared. What if accidentally I put my head right on? No, to be safe, just don't really. Just follow instructions. Don't use the shower head until after 2 weeks. I mean, that's at least my personal recommendation. You don't want to regret in the end that just because you felt like it's got more comfortable you doing the shower, then it's gonna like, affect everything.
Do sponge bath. Sponge bath. Sponge
yes,
bath.
there you go.
Any last questions, Lee or Ate Sonia?
Oh, my question. I think that my question is, I don't know if it's a question. I just want to say it will be a ride that will be very, very interesting, but eventually you will grow and it will grow and we will see. Spring is here.
I'm scared. I'll be honest with you. I don't know what the outcome will be, but I just feel like for the sake of doing it, nothing in life is for sure. But how will you know if you don't even try? So you need to try and you need to do it, because if you don't, you'll be questioning yourself forever, which I did for 7 solid years in front of the mirror. And that's the reason why, look at our video since day one. There's not one video that I did not wear any makeup, that I did not have false eyelash, that did not have smoky eye, that I did not have my bandana. That's because I'm insecure. I'm finally free from my insecurities. At least for now. For now, at least.
And you're so brave doing that. And, with this, the YouTube, the social media thing, I mean, opening your surgeries to the people, it will inspire and perspective of people of what surgery is. So that's very good. Before our time, nothing's like this. So, that's very good, Ally.
Yeah, I mean, more than anything, really, let's face it. I mean, we always say, of course, you need to be nice on the inside. Everyone aims to be kind. But let's face it, if you're not happy with what you see in the mirror, it's hard. It's hard. It's kind of like you are your own worst enemy. Other people
Love
will always
yourself.
see other people will always see the goodness in you, but you are your worst enemy. I was my worst enemy. So
I do have a question, because like I from like how I know you, Ally, you're always on the go and you always keep yourself busy. So now that you're recuperating, at least for 2 weeks from your surgery, is there anything internally that you figured out yourself during this time that you have slowed down quite a little bit? Like, I know you're not slowing down a lot, but like, have you ever like internally like thought about yourself during the time that you're resting and recuperating, and figure out something else about yourself during the process?
I love being off. I live like how I lived when I was in the Philippines. All I watched were like Filipino movies, things like that. But along the way I was like, oh, I still need to work. Meaning you saw, like, I never seen myself put episodes every day, but I felt like it's important for us to do this just so that people can really see what's going on. I know that I did an episode where how to shampoo your hair. Well, because it's as simple as it sounds. How do you really shampoo your hair? You get what I mean? Like those things, like as simple as it sounds, how to rinse your head. How do I rinse my head? So at least a visual representation, if it's gonna help someone, that's the reason why I did those things as well. It's super simple. It's like if someone's gonna be like, there's a lot of trolls, they would think it's stupid. You know what? It's not stupid for other people because other people need a visual, not representation, but visual example. But yes, Lee, I super enjoyed it. I'm quite sad that's gonna end tomorrow. But then again, we need to work in order for us to pay the bills. Because if I don't work, then I will not be able to pay certain things that need to be paid. So we need to be kind of like a grown up as well.
And
And you
speaking
just
about
had your mass
Casper,
phase.
I'm sorry.
You just had your mass phase. I said you just had your time. You had your time, and you didn't even. You are healing inside and of course outside, and of course, and you are now. I mean, we are now every people that had done surgery, had undergone surgery. They're learning more about themselves, and and appreciating what is more in life. As you said, Ali, you just told everybody how to rinse your hair. I mean, that's our simple basic, but the people don't even talk about. And you see, people are watching it in YouTube. Oh, you are teaching, you are sharing, and you are sharing your life to people.
And I'm gonna
And
have an
we
episode
are.
about. Thank you, Ate Sonia. Speaking of that, I even gonna have an episode about my allergic reaction to this shampoo. But I also want to put out there the things that did not work. I think when you put yourself out there, it should not be just the good things. You also need to share the things that did not work. Because you know what? Hopefully you can
Pros
save
and
someone
cons.
from that same problem too. And by the way, if there are things that we were not able to answer here, you can please direct message us, Angel, Qinan, AllyCat, Castle. I'm glued on my phone. I can answer you through Facebook Messenger or Transgender TV on Instagram. You can email us. Really, I'm not even
And
kidding.
leave a comment. Leave a comment for your questions because I know we're already running over time, so we have to like wrap it up soon. Before the last words from all of us, I want to read Veronica Ray's question. But yes, at what Ali said, please message us. Please leave in the comments your questions, and we can still keep answering it. I know it's a hot topic. I'm sure there's a lot of other questions that will come up even after this episode. And Ali is very open about that. You can follow her journey here on Transistor TV. She has a specific playlist, or you can comment it below and we're going to try to answer it for you. Veronica's question is, are you mentally prepared enough if the procedure doesn't work to your expectations? And if it doesn't work, will you do it again?
I hope it, first and foremost, thank you for that question, but that's a very good question. I hope it at least works. If it doesn't work, I'm gonna cry, but I may have to do it again. Yes. I'm open to either a retouch, and if it doesn't work, I'm gonna do it again. And if that second part will not work, then perhaps it's not for me. But I really hope it works. I really hope it works. But if it doesn't work, I'll do it again. Even if it takes 45 injections.
We will all join you in prayer that it also works. And
To pray for me that it works. You know, it's hard. But yes, Veronica, no doubt. You know what? We're all gonna die someday without our money right there in our grave. And you know what? We're all generous of everything, of our stories, of what we have. But we need to take care of ourselves. Especially, I think, as Filipinos, we think so much of our families. We think of other people first before us. I'm sorry. What I learned from living in America, sometimes you need to also put yourself first. So yes, I will spend another $15,000 if I have to, if my first surgery did not fucking work.
Okay, any last words to Ate Sonia, Lee, and to our for our viewers? And Ramfer did a praying sign with a heart. So we are rooting for you, Ali. We are rooting for your hair roots to grow. Ate Sonia, any last words and any promotion?
Yes, Ali, it will work. And if, as you've said, try and try. You know, I mean, don't you cry because you are just you are now in you are gaining more in life with that, and try if it took, because hey, it's your it's your head, it's your hair, it's your life. So do it, just do it. And of course, expect the unexpected, but of course, but you know, that is a big step in your life that you did, and you are now healing. You are healing now because we are doing this talk, and you're so lucky that you are conveying your journey to us. So don't worry, don't worry. It will be fine. It will be fine. It will be fine.
And last promotions, Ate Sonia.
And of course, Sonia the only one in my social media accounts. And of course, Kotoshi mo yoroshiku onegai shimasu. Let's have a better year this year, everybody. Kotoshi mo yoroshiku onegai shimasu. Arigatou gozaimasu. Transgender TV.
Lee.
Well, like to the viewers, I just also want to say Happy New Year to everyone. Also, I want to express my condolences to the family of the icon, the legend, Betty White. I love Betty White, and Betty White has done so much for not only the trans community, but also to try to make to end racism. They're such an icon, and I love them to pieces. And also another icon, one of my sisters that I've grew up watching perform in a lot of shows, and that helped my friend Dara perform as well. Leslie Monroy, may you rest in peace. I'm so sorry to hear that you passed away. And then that's hard because I really love that she's Goddess Cobra. She always says potty time. I love her. And anyways, Ali, like we said earlier, from me and Miss J, happy new hair to you. We're so excited to see the rest of your journey.
Any last promotions?
Just follow me, y'all, if you want to just see stuff that are stupid, because I'm stupid as F.
Don't think that's correct. But my last words for you, Ali, is I'm very, very proud of you. I think being vocal about it, being open about it. I wasn't sure because I think our last episode, when I asked about your cutting your hair, it sounds like you weren't even sure if you're going to disclose that you're going to be doing the hair transplant surgery. But I'm very proud that you're very open about it and you're processing it. And this is a true testament that we as transgender people, we as human beings, we all have our own unique obstacles and unique experiences and unique things that we have to go through. In your case, your hair transplant surgery is very unique to you, and congratulations for that. And I'm so proud of you. And I'm praying and hoping that it goes well. And let me add our last words of encouragement from our viewers. Lena said, "Love you all. Recover well, Ali." Veronica Ray says, "Big hug, sister. Love you, girl." We are here for you, Ali. Thank you very much and congratulations. I'm Angel Qinan. That's ANGLQINAN on Instagram. And I'm a nurse. And you can also keep following us here on Transistors TV. If you haven't subscribed yet, please subscribe. And please please comment here. And of course, save the best for last, Miss AllyCat Castle, for your last words for our viewers. For those who are thinking about the surgery, anything, and your last promotion, and to end the episode tonight.
I think if there's a word that I would like to first start with for the year 2022, self-confidence. I'm sorry, I now believe self-confidence is everything. Whether that be being a kind person, whether that be doing surgery to make you happy, whatever it is that you need to do in order for you to have that self-confidence when you feel like you get out of your house and you're like the most beautiful woman, man ever, do it. It's the power that people cannot give you if you don't give yourself. On that note, thank you for supporting us here on Transistors TV. And we do this for our friends globally. I started another channel together with my sisters, but it's kind of like in the works. It's called Trans po ako, meaning I am trans, but it's specifically honored for Filipino people who wants something that's like pure Tagalog episode. I just did that basically for the Filipino people who wants to hear us speak in their native language. And it may be hard, but it's like a trial right now. So if you want to check it out. It's called Trans po ako. So TRANS, and then the next second word is PO, and then the third word is AKO. But here, Trans Sisters TV is our main channel because it's here, we're here with us, with all of you from all over the world. That one is like in the works specifically for to give honor to our countrymen in the Philippines who would like to hear us speak in Tagalog, in our native tongue. On that note, thank you so much for being here on Transgender TV. Happy New Year! Manigong bagong taon, and we love you all very much. Sorry if I'm an emotional wreck today.
Oh, we love you, Ali. We love you, everyone. Happy New Year, everyone. And thank you, Lena. And she said, Angel, great job hosting. Thank you so much. Bye, everyone. Thank you, Lee. Thank you, Sonia. Thank you, Ali. Congratulations. And Happy New Year. Bye.
Happy New Year, love. Bye.